There is a major change coming in the way Australia combats our most commonly diagnosed cancer, prostate cancer. A draft of the new clinical guidelines is now out and it's all about early detection from an earlier age. Professor Jeff Dunn is the Chief of Mission at the Prostate Cancer Foundation of Australia. All right, Professor Dunn, what are the biggest changes that are being proposed in these new PSA guidelines?
To be honest, you've summarised the biggest change. In a sense, we are moving from what was a discretionary, opportunistic program of testing to an evidence-based, proactive framework for the early detection of prostate cancer, which we believe will save lives, will help us detect this disease earlier and will make a difference.
This is all about early detection, as you say. Why is early detection so important in prostate cancer?
Well, prostate cancer, like any cancer, the earlier you detect it, the greater the options, the more choices clinicians and their patients together have about how it's treated. The likelihood of favourable outcomes is higher. We need to detect prostate cancer early. In Australia, if we detect prostate cancer at an early stage, the survival rates are in the high 90%. Sadly, about a third of prostate cancers are still detected in later stage when there are more complex issues around treatment. We need to detect prostate cancer as early as possible to deliver the best possible outcomes.
What kind of impact will these new guidelines have on breaking down the myths of a PSA test?
Well, we're hopeful that these new guidelines help deliver a paradigm shift in relation to discussions about this cancer in our country. We need to raise awareness. We need to improve education. If we look at feedback about the 2016 guidelines, the current ones that we've updated, quite often we hear that there wasn't enough awareness, there wasn't enough education, that these guidelines were not uniformly applied across our health system. These are the things that we need to change. These new guidelines are clear. They are evidence-based. They are guidelines that apply to all men. We actually pay quite attention to those men at higher risk, men with family history, men from origins from sub-Saharan Africa, men with a family history of BRCA genes, men who are interested in their prostate health. Let's get the discussion going. Let's raise awareness, improve education, and improve the health status of men in this country.
Now, the PCFA has a goal of 0 deaths from prostate cancer. How big of a step is these new guidelines in achieving that goal?
Well, this is a significant step. We believe once implemented, these new guidelines will save lives. We are confident that once implemented, this will be a world-leading framework, a world-leading program in the early detection of prostate cancer, and we believe the rest of the world will follow. So again, now's the time for all Australians out there, if you have an interest in prostate cancer, whether you're a consumer, a patient, a community member, a health service provider, please take the opportunity to give us your opinions.
It is big and important change. Professor Jeff Dunn from the Prostate Cancer Foundation of Australia, thanks for your time.
Thank you very much, Will.